Okay, so good afternoon, everyone in the room and online. I want to start the seminar today with an acknowledgement of country. So here in Meanjin, we are on the lands of the Jagera and Turrbal peoples, and I pay my respect to their ancestors and descendants who continue cultural and spiritual connection to country. And I want to recognise and acknowledge First Nations people who may be in the room or joining us online or even watching the recording later, at sometime later. This has always been a place of learning and of sharing of knowledge going back thousands of years. And I want to acknowledge the Aboriginal and Torres Strait Islander people as the first scientists and healers in Australia. I also want to affirm UQ's strong commitment to equity, diversity and inclusion, which recognises that a diverse and inclusive community fosters innovation, excellence and a respectful environment for everyone. For those who don't know me, I'm Coral Gartner and I'm the Director of Research and Research Training in the School of Public Health, and I'm also the Director of the Tobacco Endgame Centre of Research Excellence. So it's my pleasure to introduce this week's speaker, who is a visiting researcher with our research centre. Dr. Megan Roberts is an Associate Professor in the College of Public Health at The Ohio State University in the Division of Health Behaviour and Health Promotion. Her research focuses on tobacco use among populations historically targeted by the tobacco industry, including adolescents, young adults, racially and ethnically minoritized individuals, and individuals living in rural areas. As a social scientist, her research focuses on monitoring and prevention, including policy-based prevention methods. Megan uses several different methodologies in her research, and we'll be hearing about some of the findings from this research on the topic of youth tobacco prevention, moving towards equity and the end game. So now I'd like to welcome Megan to the microphone and hand over to you.
Thank you so much. That was a lovely introduction. I'm really excited and happy to be here. I feel like I've had such a warm welcome so far, and I'm really feeling energized by the research discussions that I've had already, and I'm really happy that I still have a couple more weeks with you all. So I'll just get started my presentation, and hopefully this will also inspire further conversations. Wait for our slides, give it minutes. There we go. I also want to acknowledge my many collaborators. I do a lot of team science, as well as the funding that supported this work from the American Heart Association and our National Cancer Institutes. So I'm framing my talk around a concept that I know people in this room are very familiar with, which is the tobacco endgame. There's different definitions, but just to give us a working definition, the goal of phasing out the sale of commercial tobacco products to near zero levels. And for decades, this has been discussed often as kind of a conceptual idea, kind of this end goal that we weren't expecting to reach, but that we were kind of, the philosophy was that's kind of what we had in mind. But more recently, it's been talked about more in terms of something that could actually be achievable, something that could be feasible. So kind of just go a little bit into that trend. These are rates showing you the prevalence of cigarette use in the United States, peaked around the 1960s, but has been just gradually declining since that time. Here's some more recent data going up through 2021. So the blue line are adult prevalence, and then the yellow line is youth, and peak youth tobacco use in the US peaked around the 90s and has been slowly declining. Go a little bit more into youth tobacco use. So here are rates for different products. Cigarettes was historically the most predominant product. We had a huge surge around 2018 with the introduction of Juul e-cigarettes, but even in the last year, 2 years, we've been seeing that decline again. Right, so again, there's this kind of growing consensus that we should actually be thinking about a tobacco endgame, and that it could be achieved through kind of this combination of continued implementation of established measures, right? So things we know work, like cessation counseling, youth education in schools, as well as new and innovative policies that can help us continue pushing the envelope. And with all that in mind, we also have to continue keeping an eye on equity. So this is from a paper I did a few years ago, where we looked at trends in tobacco among rural versus urban adults in the US. And what we found was that even though urban use, which was kind of by this definition, urban and suburban prevalence was going down as we see at the population level. It really hasn't been going down for individuals living in rural areas. So I leave this up as just an example of how we can't just rely on population level trends. We do have to look also at subgroup levels. So that is kind of, or this slide is kind of my research in a nutshell. I would say half of what I do has to do with monitoring trends, and then the other half has to do with investigating interventions. So we monitor trends in order to improve our understanding of what's going on, including factors driving behavior, as well as trying to identify and address new challenges. And with the tobacco industry, there's always kind of new products on the horizon. And then investigating interventions. So trying to enhance existing approaches. This can mean, for example, improving a policy by improving how it's enforced. And then also evaluating new and innovative policies. And then kind of cross-cutting around this is just continuously asking about equity and trying to look into subgroups. Okay. So I'm going to now start diving into some of the research I've done, and I'll start by talking about monitoring trends. One just brief example has to do with nicotine pouches, which I understand have not really infiltrated Australia yet. The most popular brand we're seeing is Zyn. So nicotine pouches are little pouches like this. They're probably about this big, filled with synthetic nicotine, and it's kind of in like a crystallized form. If you break the packets open, it's kind of a white polymer kind of substance in there. And you put it in your lip as if it was chewing tobacco on the top or the bottom, and hold it against your gums, and your body starts absorbing the nicotine. As with other novel products, Zyn kind of talks about theirs being a cessation aid, helping people quit, but we're also seeing a lot of youth uptake. So we did a survey just this past semester with undergraduate and graduate students. And we found that 15% of the undergraduates and 11% of the graduate students had tried a nicotine pouch. The most common subpopulation was men in fraternities. And this aligns with what we've been observing anecdotally online, kind of this like bro culture of guys who are using nicotine pouches recreationally. We had a list of reasons that they're using and asked them to endorse up to 3. The most commonly endorsed reason for use, especially among the people who were using regularly, was I like the buzz. Other common ones were saying it enhances the feeling of alcohol or other substances. Graduate students were more likely to be endorsing that it keeps them alert and focused when studying. Because again, the nicotine, right, is giving you some adrenaline. And some people did talk about how it would help them quit or reduce their use of vapes or e-cigarettes. So, and then the most common reason for non-use, we asked people who weren't using why not, and they said they were worried about the long-term health effects. So this is something that we're writing up as a brief report just because there is not a lot of prevalence data yet, mostly just anecdotal about what use looks like in the US. A much bigger study that's been going on that I'm involved with is our OSU T-Course, which is one of several centers that are funded by the National Institute of Health and our FDA, which is the regulatory body for all tobacco products. So this is a multi-million-dollar grant project. There's one here at Ohio State, and there's others across different parts of the country. This one is being led by Ted Wagner and Peter Shields, who are in the middle. And our project is broadly focused on the 3 dimensions of nicotine. So we break this down into concentration. So we're all familiar with just nicotine concentration. Typically, it ranges from 0 to 8% in e-cigarettes or products like that. There's also nicotine form. So traditionally, nicotine is in freebase form, but it can also be turned into nicotine salt by adding an acid, and that lowers the pH. And this was kind of the innovation that Juul e-cigarettes brought to the table. And this just makes it less aversive, less harsh, and so it feels like it's going down easier when you're vaping. And there are also some implications for bioavailability when you're using it. And then nicotine type. So traditionally, you can get your nicotine just from the tobacco plant, but now it can also be created synthetically in the lab. And at the molecular level, there is a slight difference in the isomers. So we talk about R versus S isomer ratios. And this is also has some kind of impacts for just how products are perceived, because it's often marketed as being tobacco free, even though it contains nicotine. Young people often think it's safer just because it's synthetically derived. So this was brought on by Puff Bar, which is an e-cigarette brand, and they talked about theirs as being tobacco free and argued that they were outside of the FDA's regulatory authority because they were not a tobacco derived product. So it took a little bit of time for the FDA to say, no, anything with nicotine, regardless of whether it comes from a tobacco plant, is a nicotine or tobacco product. So I'm not a chemist. That's about as far as I can go into explaining these different dimensions, but we do have several chemists on our team who are kind of doing laboratory bench science, looking at the implications of these for things like bioavailability and addiction. And I should say Zyn is also a synthetic product. But I'm co-leading Project 4 with my colleague Amy Furkatich, and we have 4 projects. Ours is meant to be kind of the observational counterpoint. So all the other projects on this T-Course are doing laboratory work, and we're doing a naturalistic observational youth cohort study with no experimental manipulations, just monitoring. And it's intended to provide real world information to kind of supplement and answer those questions. And we also have a particular focus on populations that have been targeted by the tobacco industry, including LGBTQ youth, youth with mental health disorders like anxiety or depression, and youth living in rural areas. We're not doing any particular targeting of these populations during enrollment just because use is so high. Anyway, we're just getting them naturally into the study. We have been monitoring, and that is the case. So for this study, we're enrolling a large cohort on a rolling basis, anyone aged 13 to 25, who are people who've recently started using either e-cigarettes or nicotine pouches. And these are the most common products used by young people in the US. They come from all over the US, although it is a convenient sample. We're not doing any sort of stratified approach. But we are monitoring enrollment to make sure we're getting sufficient representation from those priority populations. And the goal is to follow them over a 2-year period so that we can look at different, look at their trajectories and use basically. We're surveying them every 6 months. It's all online. And they're also doing smartphone-based recordings where they use an app on their phone to provide a couple surveys a day for a week-long period of kind of a burst of data collection. I'll talk a little bit more about that. Our problem too was that we were trying to assess these nicotine dimensions, but pilot data was showing us that youth cannot self-report about their nicotine dimensions. So we actually had a survey where we asked just, what kind of nicotine is in your e-cigarette? Is it salt or freebase? Is it synthetic or tobacco derived? We were using lay terms, but you can see about 3/4 of the sample just did not know, which is concerning in and of itself, but confirms our suspicions that young people cannot just self-report what they're using. So then how do we know? How do we look at how these dimensions are impacting use trajectories? And so that's where a lot of our EMA comes in. What we're having people do is report about their use and report about their brands, and especially take pictures of what they're using so that on the back end, we can figure out and assign, basically code for what products that they're using. So here's some submissions that have come in from participants. They are the generation of Instagram and selfies and social media, so they take beautiful pictures. We were concerned at the beginning that things would be blurry, but no, these are like very typical pictures that we're seeing. We do also get a lot of like hands and backgrounds. These ones are less identifiable. But then what we do on the back end is say, okay, so that's a Zyn and it's wintergreen flavored and it's 3 milligrams, and we know from our research that it's synthetic and that it's salt-based. This is a Buzz Bar. It's sherbet punch flavored. So then we can go online and look up, a sherbet punch flavored Buzz Bar and kind of figure out, okay, that's also synthetic and it comes at this concentration. So this is the timeline for what we actually share this with participants about what they're doing, but surveys every 6 months and then EMA every 12 months. where they're telling us again about their brand, what they're doing. We do ask them for any nicotine information they can give us. And then we're looking at how those dimensions will impact perceptions, patterns of escalation, and then changes in nicotine dependence. Before I left on my trip, we had around 250 people enrolled, about 82% for e-cigarette use, 56% for nicotine pouch use. You can see these add to more than 100 because we have lots of people who are dual using. Our most popular brands, definitely Geek Bar is rising as the most popular e-cigarette brand, and Zyn has just consistently been the most popular nicotine pouch brand. Another emerging finding, we had seen that there were certain e-cigarette brands that were providing these boost modes. And so we added a question in January, just does your product have a boost or a pulse function? Seems to vary a little bit by brand, but essentially there's a button you can press. These are all kind of cool techie e-cigarettes where you can press a button that will kind of boost the changes like the coil, basically the heat and the output of the vape. So instead of coming in kind of continuously, it kind of pulses it out more strongly, which of course has implications for nicotine uptake because it's kind of giving you a stronger pulse of your e-liquid. So we asked that question, and what we found was that a lot of people, especially because they're using Geek Bar, are have an e-cigarette with that capability. And then we had another question about how often they're using it, and lots of people are using it pretty regularly, not all the time, but pretty regularly. So the nice thing about this big center grant is that we can then, that same day, email the chemists who are on the project and say, what are the implications of this? And they'll say, this is really interesting. Maybe we should start, we're going to buy some Geek Bars with these functions, and we're going to start testing them in our lab so that we can kind of collaborate on our findings. So then another component of monitoring that I do has to do with the environment where young people are embedded, and that's the tobacco retailer. So tobacco retailers are a concern because they provide access. In the United States especially, we have these power walls, they're called, behind the retailer. And it's just very easy to get your hands on a tobacco product. And they also provide marketing. So this is kind of a more extreme example, but there are tobacco retailers and even convenience stores that look like this, right? So you can see they have some candy and things like that, but often there's very in-your-face marketing. Here's a picture I actually took of a gas station in a rural part of our state. And if you look kind of carefully, there are just tobacco ads everywhere. And so you don't have to be even interested in purchasing tobacco to be you might just be trying to pump gas into your car and getting exposed to this type of marketing. And in a previous EMA study where we had people responding about using an app to respond about where they were being exposed to marketing, the most common locations were convenience stores or gas stations or grocery stores, supermarkets, or pharmacies. And I'll say as an aside too, during this previous study where we had people reporting about their marketing, we also asked about if they liked the ads and if they think they'll use in the future. People who were getting more exposed to tobacco products, even just during a short period of time, were having more positive responses and higher expectancies to use tobacco in the future. And this is not just a finding from our group. Lots of people have kind of consistently found this effect. And then we also have a concern about disparities because where tobacco is being advertised, the extent of marketing differs, right? So a nicer suburb might just have one little small ad in their window, but other types of areas are going to have a lot more marketing on the premises. So then getting into retailer density, which is something I'm particularly interested in. Just to give you a definition, this just refers to the number of places that sell tobacco within a certain area. This can be looked at in terms of like square miles or square meters, or it can be looked at in terms of population size, so per capita. And that's generally what I look at is per capita retailer density. why we're concerned about this is because we know that greater density of tobacco retailers is associated with more access to tobacco products, as well as more exposure to tobacco marketing. And then there's also a good body of research showing that, again, more access to tobacco marketing at that point of sale can distort adolescent perceptions about the availability and popularity of tobacco, increase curiosity about tobacco use, increases the likelihood of smoking initiation. So youth just who live in a more retailer dense area are more likely to initiate. And it also for adults can impede smoking cessation. So if you're making a quit attempt and you live in a more tobacco dense area, you're more likely to have a relapse. And it's also an equity concern. So there are density disparities based on poverty, race, and LGBTQ status. To give you an example of what we've done, so this is a map of Ohio, where Ohio State University is located, and we were looking at per capita tobacco retailer density. So here, darker colors are showing you census tracts, which are kind of small geographic areas. They're showing you census tracts with a higher density of tobacco retailers. I know people are not going to be familiar with the geographic makeup of Ohio, but that's Columbus, where Ohio State University is located. So that's an urban center. We also have Cleveland and Cincinnati, Dayton and Toledo. These are all urban areas, and they had greater tobacco retailer density. And this is, again, per capita. So we're accounting for population size. And then around them, you can see this lighter shade. So around each city is kind of this lighter shade, shading of census tracts. And this is the suburb effect. So these areas are generally more advantaged areas, and they just have less retailer density. And then we also have a lot of rural parts to this state. The Appalachian Mountains actually cut through kind of this part of the state. And so in these rural areas, per capita tobacco retailer density is also higher. Digging down a little into the urban effect, this is Franklin County, which encompasses a lot of Columbus. And the map I'm showing you here is poverty levels. So brighter red colors are showing you higher poverty rates in the city. And if you overlay this with tobacco retailer density, you can see how strong an association that is. We show this statistically, of course. I also had a student who looked at kind of the historical legacy of this. So she was really interested in redlining. Is that a term people are familiar with? So another historical misfortune in the United States around the 1960s or so, 1950s, 1960s, the many bank corporations had this big effort to draw out districts within all of the major cities in the United States and indicate which ones were worth investing in, right? So these are places where you could get a loan to develop your business or to build houses or, improve a house, things like that. And so the green was considered best, and then red was considered hazardous. And those were areas where it would be almost impossible to get a business loan or any type of financial mortgage loan. And this was very race-based. So the decisions for these, how they were going to map was really driven by the racial composition of the neighborhood, as primarily if there were Black Americans living there. So what the student did was, working with a spatial statistician, identified areas. She found the old redlined maps in Ohio and identified which current census tracts were, back historically labeled as red or green or blue. And then looked at how that related to present day tobacco retailer density, and there was an association. So it's this very long-term legacy of redlining and development, and where retailers, often predatory retailers, are setting up shop. And then finally, I once had a reviewer say, how do you know, you're showing disparities in use and you're showing disparities in density, but there's no evidence that they are associated. So we did a paper to show that. I had another student who looked at within different regions the association between density and disparities in tobacco use, primarily smoking, and disparities in retailer density. And she defined disparities based on poverty or disparities based on race and ethnicity. And we demonstrated correlations to kind of show that these two kind of disparities, areas of research were in fact related. And then I'll get into this a little bit later, but the type of store matters as well. So we had, for example, a lot of corner stores, sometimes they're called bodegas, and those were very common in low-income urban areas. And then we also have dollar stores like Dollar General or Family Dollar. These are kind of discount stores. They have a lot of products that historically cost $1 or less, not the tobacco, of course, but you can go in and buy party favors or paper goods or things like that. Like my grandparents love shopping at dollar stores. They are very common in rural areas and they often have tobacco at cheaper prices. Okay. So I'm now going to transition. That was all kind of observational work, describing disparities, describing different trends. But I've become increasingly interested in, the question of what can we do about this? How can we, change what we're observing? So I'll first get into just the idea of enhancing existing approaches, right? So we have our whole T-cores looking at these dimensions of nicotine. How could federal governments address these recent differences or what we've observed? And the way that the US FDA, as well as many different federal governments across the globe, can intervene is by implementing product standards. So, for example, having rules about nicotine concentration or the R to S isomer ratio, things like that. So that's a power that federal government could enforce if they wished. Marketing restrictions. In the US, it's a little tricky, but other countries have more authority to just restrict marketing. And in the US, even though we're kind of restricted in terms of, for example, we cannot ban products at the point of sale, there are limits to how far you can go. For example, you can't have cartoon animals on your tobacco ads, things like that, that are very blatantly targeting children. As well as public education, so making sure that citizens and society are aware of the implications of what they're using. And then improving existing approaches when we have to do with tobacco retailer density, we can improve our current systems of retailer licensing. So again, what we can't do is restrict marketing. This is actually a photo from Canada when they implemented it within the last 5 years or ago. Restrictions on marketing at the point of sale, including that power wall behind the retailer. They kind of just temporarily put up little covers over those. So behind those blue kind of lotto sign, there's packs and packs of cigarettes. Now it looks a little bit more like what I've seen in Australia, where it's just other kind of more higher end items behind the cashier. So in the US, the courts have ruled that it's a freedom of speech issue, that companies should have the right to advertise their own products. Kind of a tricky idea that corporations having, a right to free speech, but that's kind of where we are right now. And so tobacco retailers or tobacco researchers have pivoted to say, okay, what else can we do? If we can't restrict marketing at the point of sale, can we just restrict who's selling tobacco in the first place? So that's what led up to licensing law strategies. These are policies that require stores to obtain a license to sell tobacco. So just like you need in the US a liquor license or a license to sell guns or a license to cut hair, arguing that you need a license to sell tobacco. And this does not exist in all states in the US, but it's in the majority of them at this point. There's many advantages to this. It provides an inventory to track and monitor retailers, so we actually know who's selling tobacco, and then enforcement bodies know where they need to be going. Poses a bit of a barrier to selling tobacco because of just the cost of having to do that, the cost of the license itself, and the administrative burden of having to renew your license every year. And then the money from the license also can then turn around and fund the people who are doing the inspections and the enforcement. So it's kind of meant to be a sustainable approach. But licensing laws can also do more. They can set additional stipulations aimed at restricting density. So here are the four most common licensing law restrictions in the United States. The first one is capping, where you cap the number of retailers in an area, often based on population size. So you can't have more than one retailer for every 1,000 people in the district. Declustering is where you prohibit retailers from being close to each other. So if you're applying for a license, you cannot have a license if there's another retailer within 500 feet of where you want to be operating. School-based, prohibiting retailers from being close to schools, like you can't have a retailer within 1,000 feet of a school. And then pharmacy-based, where you prohibit the sale of tobacco in pharmacies. So these have been around in the US for a little while. Several major cities and states have been implementing these strategies, often in combination. I just have a couple up there to give you an example. And so we conducted a project that kind of took this a step further. We knew that simulations and preliminary evaluations of those cities that were implementing strategies were showing they were, pretty powerful at reducing density. But there hadn't been a lot of work looking at disparities. And remember, that's kind of this recurring theme in my research of we can't just look at population level effects. So our questions were, would it be equitable? Could it unintentionally exacerbate disparities, which we know happens, unfortunately, with some policies? So working with my colleague, Peter Kragmile, who's a spatial statistician, we went to Ohio, where at the time there were no licensing law strategies, and we simulated those four main types of strategies I had up on the screen, as well as different combinations to see just what they would do to disparities. I'm not going to go through this whole table, but if people are interested, I can go back to it or share the paper with you. But what essentially we looked at was, how would each type of licensing law impact different types of communities? And the takeaway was that licensing law strategies could reduce density by up to 20%. And the most impactful licensing law strategy depended on the type of community. So we weren't seeing one strategy as being equitable across the board. It depended on the community. For example, school-based strategies were very equitable for low-income, African-American, and urban neighborhoods, whereas capping-based restrictions were better for low-income and rural areas. And we think this has to do just with how things are spaced in a rural versus an urban environment. In an urban environment where things are kind of more clustered together, something like a school restriction is going to cut out a fair amount of retailers. But in a rural area where everything's a little more spread out, banning retailers from 500 feet of a school is not really going to do too much. So these capping based, which are just kind of based on population size, were found to be more equitable. And then across the board, pharmacy bans were demonstrating inequitable impacts. And that's because pharmacies in the US are generally more common in affluent areas. So although they were reducing retailers everywhere, they were reducing the most retailers in the most affluent neighborhoods. So they were not being equitable. So we've been sharing this information with different, policy interested groups. We've put together this very simple fact sheet showing you, based on your community type, what type of strategy would be the best. And continuing to take off. For example, Ohio now has a couple licensing law strategies. And so for the last part or the last chunk of my presentation today, I want to talk a bit about new and innovative policies. And this kind of flows off of the last part about tobacco retailers, a new type of policy, which we're referring to as age-restricted location policies, or ARLs. These are policies that would limit tobacco sales to retailers that bar entry to anyone under age 21. So basically making tobacco only allowed in adult-only stores. So going back to my map that I showed you earlier, it would essentially prohibit tobacco sales in anywhere that allowed children on the premises. It wouldn't force those stores to close down. It would just not allow them to sell tobacco products. So it would limit tobacco sales to locations like vape, alcohol, and tobacco stores, but prohibit it at locations like convenience stores and discount stores. So ARLs have been introduced in the Netherlands. They're being considered in the US. For example, they were on the docket in California, but they have not yet been passed anywhere in the US. We recently had a commentary published in the American Journal of Public Health where we talked about just the promise of ARLs. So we argued, based on very preliminary data, that they could really drastically cut down on retailer density. And this would in turn reduce initiation, help with cessation, and could potentially reduce disparities. And we also argued that it could complement existing age of sale policies. So in the US, tobacco, the age for selling tobacco is 21. So you have to be, an individual has to be 21 to purchase tobacco. And so having it be a 21 and older store would kind of complement that idea. And likewise, alcohol sales, a lot of alcohol stores, you have to be 21 or older to enter. However, as we were working on this project, we were aware that there were potential pitfalls. So we weren't sure if it would be equitable for all communities. We had only really looked at it in Ohio. And we weren't sure exactly how youth would be impacted, because we know youth are very clever and innovative at getting their hands on tobacco products. And they go to specific stores and often use kind of these focal retailers. And we weren't sure if those focal retailers would fall within what would be impacted by an ARL. So this ongoing project is intended to model the potential impact of an ARL on youth tobacco use, both overall and for different historically marginalized population. And we're investigating this using a combination of retailer modeling and collection of new youth data. And we're looking at 4 specific states. So the small one up there is Connecticut, Ohio, North Carolina, and California. These actually represent 4 different regions in the US. I know it kind of looks like 3 of them are all clustered up there, but they have very different geographies and histories. So Connecticut is in New England, Ohio is in the Midwest, North Carolina is in the South, and California is in the West. And each state also has a different priority population of interest. So when we're looking at youth, when we're enrolling youth, or when we're looking at communities, we're trying to over-enroll for those priority populations. Okay. So we've now at this point mapped out the retailer data. What we found is that in terms of just sheer number of retailers, California has the most. They have over 22,000 places that sell tobacco. But California is also a huge state with a much larger population. So if you look at retailer density, so if we're looking at per capita, California is actually doing the best. They actually are pretty forward and progressive in their tobacco policies. And it's Connecticut that has the worst tobacco retailer density. This is a map of retailers per 1,000 people. Obviously, it's not to scale because, again, California is much bigger than the other states. A little bit hard to glean just by eyeballing this where the patterns are. And then this is our breakdown. We've started coding by retailer type. And across the board, convenience stores are the most common type of retailer selling tobacco. And then there's a little bit of variation within different types. For example, discount stores are more common in the Midwest and the South. In each of these states, we began by just looking at baseline disparities. The most robust effect was the impact of poverty. So on the x-axis, that's poverty, and the y-axis is retailer density. So for all states, the higher the neighborhood poverty level, the higher the density of tobacco retailers. And then so that we are continuing to kind of start modeling the impacts of an ARL on those populations. But in the meantime, we're also beginning to talk to actual youth about what they would do if there was an ARL to kind of get some of their information. So we've conducted a qualitative study where I actually talked to 79 different young people in focus groups. I said, I'm realizing as this is big on the screen, they were not all from Ohio. They were from our 4 different states. And about half of them were from our priority populations. We did these discussions over Zoom so that they could be remote. And we were essentially asking them questions about what would you do if this were to happen? We put it into kind of lay terms. So we would first talk about, where you get your tobacco, and then say, well, I have a hypothetical question for you now. What would you do if that retailer closed? What would you do if a policy happened where you could only get it at vape shops or tobacco shops? So we kind of worked through those different scenarios. What we found was that most people, including minors who should not be able to buy tobacco in stores, they were all reporting that their main methods for getting tobacco was by purchasing it in retailers, and in particular from tobacco shops and vape shops. So here's a quote from one young woman. Usually gas stations and other places are more strict about it and won't sell tobacco unless you have an ID. Most of the time, vape shops just don't really care as much. As long as they're getting money from it, they just don't really care. And then a lot of them, or the majority of them, did not think this type of policy would be impactful, especially because it would still be allowed to operate. Yeah, I don't really get it from anywhere but vape shops and smoke shops. So they were kind of just like, I wouldn't have to change anything. I could still get it from my go-to place. And they also brought up other workarounds. So this person was talking about going online and trying to buy online. Most people were not currently buying online, but they just spoke about it as an option that they could pursue if they weren't able to get it at their current location. And then this person, we had a couple people from the South who were from tobacco growing areas. So this person said, worst comes to, I'll just go out back and start planting my own tobacco and just harvesting that. I did that growing up a little bit, and at least I know how to do it. So tobacco is kind of a difficult plant to grow. It's not the same as like growing marijuana in your basement, but these were, again, people from tobacco growing areas that kind of have the knowledge. And then some people, though, did bring up kind of how it would introduce an additional burden, right? So an ARL, if that were to happen, their local stores or their close by stores were to shut down, that they'd have to drive farther to go get it. And a lot of them talked about kind of the need to stockpile, or, I would drive 20, 25 minutes away. Some people I talked to were like 3 hours they'd be willing to drive and just kind of stock up and come back. Just take fewer visits over longer time spans to those stores. And then finally, some people did talk about how it would have them think about quitting. A lot of these, again, were young people who hadn't expected to be using tobacco for as long as they had now been using it. And so they talked about kind of it being a sign for them to quit, but acknowledging still that it would be difficult. Okay, so our conclusions from this project so far, again, this is an ongoing study. Tobacco products are very accessible to young people from retailers. So they are aware of the issue of high retailer density. They're aware that if one place closes, there's another one 5 minutes away. And that it's not too hard to find a store that will sell you tobacco even if you're under 21. And so our conclusion from this is that really any density-focused policy would need to be dramatic, as the removal of just a few stores would not greatly affect young people. So if you remember back when I was talking about licensing law strategies, they could reduce 20% of retailers at best. And that might not be enough to really see real behavioral change. So something like an ARL that could reduce 60 to 80% of retailers may also be just what's needed to really have an impact on behavior. And we'll continue to state too that fewer retailers could make enforcement, like compliance checks, more manageable. So the next steps for this project include, we have a youth EAB, an external advisory board that's weighing in on some of our design and interpretation of results. We're continuing to model ARL scenarios to see what the equity impacts would be. So far, our findings are indicating that's kind of equity neutral, so it's not going to be inequitable, but it looks like they're not as equitable as we had hoped initially. Now we're also starting to do quantitative surveys, as well as EMA with geofencing, which is where they're using apps to complete surveys, but it's there's a geofence involved. So we know where the retailers are. When they get close to one, it actually pings them to take a survey. So we're kind of getting this like mapped information about where they're purchasing and whether they've been exposed to any marketing lately. So since I have just a couple minutes left, I'm just going to really briefly mention a couple other projects that I'm either in the very early stages of or just kind of ongoing. One having to do with youth-focused policy messaging. So something that we notice is that youth are often left out of campaigns to increase public support for policies, probably because they're not voters. So, but nevertheless, even during policy rollout, greater public support leads to better policy outcomes. People are more compliant with policies if they're in support of them. So something that we're looking into is an approach that about policy messaging, helping young people be informed about why a certain policy is being implemented and trying to improve youth support for policies. And another study that I actually just had accepted yesterday has to do with crowdsourcing and kind of community mapping, which is another kind of app-based approach where people are reporting about where they're seeing tobacco in their communities. So not even necessarily people who use tobacco, but people who use and who don't use. They were being paid and incentivized to take pictures and report about tobacco retailers. This is used in some communities where there isn't a good monitoring system. So you can actually just use this kind of crowdsourcing to map out where certain things are located. But we realized it was also a great awareness raising method where we did kind of a pre-post surveys. And once they had engaged in this study, they were more supportive of policies that would reduce retailer density. So it kind of made them more aware of the impact of tobacco and tobacco litter in their neighborhoods, and then they became more supportive of those types of policies. Okay. So that brings me to the end of my talk. Again, kind of taking you through a whole agenda of what I've been doing, having to do with monitoring and interventions and focusing on equity. So thank you for your attention.
This is such a great talk. So I'll hand over to, if we have any questions in the audience, maybe start in. There is one. There's one online already? Okay, yeah, if you want to.
Someone was just wondering what data you get from Garmin. I think this was a question quite close to the start of the talk.
We don't use Garmin at all, like Garmin watches, was that? Oh, government, sorry.
What?
Maybe must misheard.
It might have been.
Okay.
Sorry, I can jump in and explain because
have a question?
oh, can you hear? Hello?
Hi, thank you for your presentation. It's really fascinating to hear about the products and patterns of use and everything in the US. It's really interesting. This is probably part comment, part question, but it's striking to me the parallels between nicotine, tobacco, research and policy, and research policy for alcohol. Interesting looking at your spatial mapping. There's been the same exercises done for alcohol in Victoria, in Australia, and also I know in mental blank in the US. I'm trying to think of the area in the US, begins with B. Baltimore, thank you. Baltimore in the US have done the same spatial mapping exercises for alcohol, and they've actually had an intervention there around zoning and regulatory reform. So, strong parallels and common health determinants in terms of social, cultural and commercial determinants, and both such widely accepted and used drugs. So I assume there's scope for learning around innovation for each of the drugs, maybe even scope for integrated holistic responses that with a health equity focus that address some of those determinants in different localities.
Other questions? Just wondering about the cost of tobacco products in America. Because here taxes have gone up and which made them very expensive. But I think in America, they've always been really, really cheap.
Yes, yeah. So they're a lot less expensive in the US. Taxes are determined at the state level. So there are state level differences. California probably 15 US dollars, 20 US dollars, but in Ohio, you could get a pack of cigarettes for maybe $6. So yeah, and then it's even cheaper if you go to, the state south of us, Kentucky, yeah, even cheaper.
That's not an option to reduce to increase the taxes.
It definitely is of interest. And I think that is kind of one of those established methods that, people continue pushing because we know it's effective.
Until it goes too far. It got illegal.
Yeah.
I just saw that it looked like someone might have popped up online. Yeah.
So that original one was saying there was a slide early on where you mentioned capturing data about type of vapes, pouches being used, including brands. Participants were asked to take photos as well. In that list, I thought I saw Garmin listed and wondered if you were capturing data via wearables.
We are not right now. Yes, we're not using Garmin. We're just having them use an app on their phone. And so it uses the camera function on their phone to take pictures. When we're using geofencing, but that again, is just like based on their phone and tracking their GPS location.
Okay. There's also another one. Why did you choose those 4 states? Ohio is obvious, but what about the others? Was it for regional, social, etc., variety or policy, similarity or convenience?
Probably a little bit of everything. Obtaining tobacco retailer data or license locations is difficult. There are some studies that use sales data to estimate where stores are located, but if you really want the license data, you have to really make public data requests at the state level. So we knew we couldn't do the whole all 50 states. So I wanted to look at different regions of the country. So those 4 regions that I mentioned are like how geographically in the census divides up the US. And then it's also where I had colleagues who I knew would be, good people to work with. So I had people at universities in all of those states who could help inform kind of what was going on locally.
I've actually got a question. So do you have licensing in every state in the
No.
US?
No, and in fact, even one of the states that we worked with, North Carolina, does not have licensing. But the people who were collaborating with, led by Joseph Lee, they have a established method for searching through other licenses, like finding petrol station licenses and kind of doing lots of online searching and kind of cobbling together a pretty accurate list that they then kind of do some ground truthing to verify. So yeah, we're definitely, I would say 2/3 of the states do licensing, but yeah, it's not widespread everywhere.
Any other questions? Yep.
Just wondering, with your qualitative research, did you find any trends or kind of trends, I suppose, from responses based on the state that the interviewee was responding from?
Yeah, that's a great question. So, and we're still analyzing that. I'm working with Rachel Caesar, who's an expert in rapid qualitative analysis. So we haven't broken down by state yet, but just based on my own observations, there were some differences. So, for example, just California being more stricter with their tobacco policies. But I was amazed by how similar the story was across all the states in terms of just being able to, find out where tobacco could be located, or even like I moved to this new place in the state and just kind of asked around and people told me like, you can go to this place and they don't card. And it was pretty interesting to me as a tobacco researcher, just how easy it was for people if they wanted tobacco that they could get it.
I've got a question about the illicit market, but in vapes. So I know, there's concern in Australia about that, there's still a lot of vapes being sold illicitly, but in the US, I understand nearly, there's quite a high proportion of the vapes on the market are actually also considered illegal products.
So there's there's definitely concern that some of them are like knockoff. For example, Geek Bar is so popular that there have been kind of knockoff Geek Bar. And if you go on their website in the US, you can even like scan the code and verify that it's a real Geek Bar and not a knockoff. And I had one participant who is from a very rural part of Ohio where there are fentanyl issues, and she was one of the unique people who had her mom buying her products for her. Her mom, because she was under 21, and she had been buying it through kind of a funny channels, and her mom was worried that she would have something that was very dangerous. And so her mom, was, I'd rather buy you e-cigarettes and have them be a safe, verified brand than have you buy it, from a plug or someone on that where it might be contaminated. But for the most part, I would say illicit e-cigarettes are not as much of an issue in
I
the US.
thought, a lot of them don't actually have marketing orders.
Yes. So in terms of that, are they, so they're not black market, but are the companies actually allowed to be selling them? Probably not. And that's more of like a lawsuit issue. So, and now, you might have heard there's some stuff going on in our governments right now, but, so there's, in order to be on the market, they now have to apply to be available on the shelves. And a lot of companies just have not done it yet and have not been approved. So it's this funny situation where technically they're illegal, but they're not considered illicit or black market. They're just don't have all the permissions and checked all the boxes.
I guess there's probably less likelihood now that FDA are going to go and take those products off the market, right?
Yes, well, also, the FDA Center for Tobacco Products has had a lot of people who've lost their jobs in the past month or so. And so I don't think they have the person power at this point to do a lot of this review.
Any other questions? Anyone online? Or we're coming up to the hour, so I might wrap up there if that's right. It's all good. Okay, great. So if you just thank me, Megan, again for her great presentation.
What's the actress is on?